Greeting and welcome back to CNC News on the updates of the Cambodia-Thailand border conflict. It should be noted that it has been more than a month since the ceasefire took effect, and still some civilians are still in safety camps and haven't returned back to their homes. Many national assistance and international assistance has been helping, such as in terms of food, materials, and other learning kits. And today we want to know more about how the international assistance has been contributing to our people. And today we invited UNICEF specialist, Mr. Michele Paba, who is Chief of Water, Sanitation, Hygiene and Climate, join us share on this matter. Greeting. Thank you for joining us today.
Thank you so much for having us.
Regarding to this matter, I know that it's in Cambodia. It is rain. It rains a lot, rainy season, and many displaced people are still at the refugee camps, who are being displaced from their home in terms of this immediate, urgent crisis. And being part of UNICEF, how has you been contributing to this help in terms of this hygiene and water sanitation to ensure their great health and during this tough time?
Thank you so much for the question. There are 2 points that I would like to make. The first one is looking a little bit the bigger picture and considering also the water and sanitation conditions at the villages where people were living. And we have done, as a humanitarian response forum, so with all the partners at the government, some assessment to see the damages to the water and sanitation services there. So we are still looking at the numbers, but overall we have noticed that in these villages, the water and sanitation services for the communities, for the schools, for the health facilities have been damaged. So there are important elements of recovery, reconstruction that needs to be considered there. When it comes to the camps, to the displacement site, water, sanitation, and hygiene is a priority. Usually, when you receive an sudden influx of people moving away from the villages and going to the center, water, sanitation, and hygiene and shelter are the 2 key priorities to allow people to have a decent living condition in this site. Particularly, water, sanitation, and hygiene are essential, of course, for drinking purposes, for your basic hygiene, but also to prevent the outbreak of disease, which are quite common in this context. As UNICEF, so far, we have responded with partners and, of course, under the guidance of the government. And we have mobilized nearly 20 tons of water, sanitation, and hygiene supplies, including equipment to treat water for drinking, hygiene kits for personal hygiene, what we call dignity kits to respond to the hygiene needs, particularly of women and girls. And we have also provided emergency latrines, so people can have comfortable places for sanitation. And we have also drilled new wells to provide safe water in the camps, in nearby schools and healthcare facilities that were affected.
I see, thank you. And in terms of logistical transportations, do you find it hard to mobilize that to the civilians who are displaced families there? Because there's a lot of them.
Well, indeed, logistic aspects are a challenge, particularly when you have to mobilize equipment and interventions in areas where there are some sensitivities. So our strategy as UNICEF is to always work with government, using government channels to ensure that there is, of course, ownership of the intervention that you do, but also that there is support of government for the outreach, so to overcome any possible hurdles in terms of logistics. And if you allow me, I would also like to mention that the overall WASH community has mobilized very quickly. After 2 days from the conflict, WASH partners were already there, UNICEF, NGOs, the whole HRF WASH team, but under the leadership of the government, particularly the Ministry of Rural Development, who's the leading agency for rural WASH, the provincial department of the rural development, and local governors and local administrations. We have been really amazed to see how the government was able to mobilize and coordinate all these efforts and to overcome any challenge that partners could face.
Could you highlight a little bit more on the civilians part? Because we have not been there yet. Some of our members' team have been there, but in terms of your services and your humanitarian activities, how do the locals responding to such guidelines and strategic when it comes to hygiene and WASH and some things that such under intense time?
Yeah, thank you for the question. Indeed, all these activities that we have promoted are effective if there is an uptake from communities, if local governments are engaged, of course, but also if there is a sort of awareness and on the risks that communities are facing in this, and if there is also some change in the behavior towards correct hygiene practices, for example. So whenever we do this intervention, and you see I've discussed mostly about the hardware part, there is also a soft component, the way we call it in our technical jargon, where we mobilize community leaders, we mobilize religious leaders and local administration to support in convening some messages. Even simply washing hands is a very easy practice, but if you're not used to do it in the proper times, before lunch, after lunch, etc., before going to the toilet, after the toilet, you know, the risk of, again, disease and health risk is high. So behavior change, awareness is a key component, and again, this is an indispensable part of our intervention along with the government counterparts.
I see. And do you find it hard to let the locals be adaptable to this kind of activities?
Not necessarily. It's more a refresher, a re-engage communities. The WASH program led by UNICEF, but also other organizations, there is, as I say, there is a very vibrant WASH community in Cambodia. The WASH program has been there for decades. So there's been already a lot of intervention outside of the humanitarian environment, let's say, where communities have been engaged to embrace proper hygiene practices, to stop defecating in open. Actually, Cambodia is moving towards open defecation-free nations, which is a significant achievement in terms of sanitation and hygiene. And this has been done, of course, because of the great commitment of the government and the support of the partners.
I see. In terms of hygienes and sanitations, I believe people who are living along the border, I believe it's some things that they also aware, but at the same time, in such intense conflict, this is some things that they also need assistance coming
Yes.
from the international and also coming from our national in terms of having to secure their safety and also their health as well. So thank you so much for sharing about this. Thank you.
Thank you. Thank you so much.
This is the end of our interview regarding how the international and also nationals assistance have been helping a lot in water sanitations to make sure that displaced peoples are being assisted and also taken care of during this tough time. And thank you so much for watching the CNC News in regard to more updates on the Cambodia-Thailand border conflict.